Hey mama, for most births today, it is the norm to give birth in a reclining position on your back. As a childbirth educator, birth doula, and mama, reclining is a position that I least recommend for most births because of how it can negatively impact mama and baby. In this video, I'm going to share with you why you should avoid laying on your back when giving birth in my 3 go-to birthing positions. And make sure you also stay through to the end because I'm going to be giving you my #1 advice when it comes to birthing your baby. I'm Bridget, and if you're new to this channel and want encouraging evidence-based information regarding pregnancy, birth, and postpartum, make sure you click the little subscribe button and the little bell next to it so you don't miss out on any future videos. So I'm going to start off by saying that women innately know how to birth their babies when they learn how to tune into their bodies and trust themselves and are given the opportunity to listen to their bodies. If you do a quick Google Images search on historical birthing positions, you'll notice that very few women are depicted giving birth on their backs. And that's because women don't typically instinctively give birth in that position. And that's because with labor and birth, when left uninterrupted, mamas will usually want to move around and change positions to help them cope with the sensations of labor and also to help them move their babies down and out from their womb into the world. However, as labor and birth have become more and more centered around a bed and a care provider, it's become a natural progression for women to push their babies out while laying on their back. The reason why this is my least favorite position as a mama is that it's actually really uncomfortable most of the time. Some of the hardest and most uncomfortable parts for me in my first labor were when I had to lay on my back either for fetal monitoring or for cervical checks. And when I was lying on my back, the only thing that I wanted to do was to get out of that position. It was my body and my baby's way of telling me that this is not the right position for labor and birth to progress. Another big reason why lying on your back while pushing is not as desirable as other positions is that mama is working against gravity to birth her baby. The birth canal that connects the uterus to the outside world is a tunnel shaped like the letter J. And when you're laying on your back, that letter J is pointing upward, which means mama is basically needing to push her baby uphill in order to be born, which I think we all can understand is going to be more difficult than if she was pushing downhill. And then the other reason why pushing on your back is not as desirable is because it doesn't allow the birth gate to open as easily. The sacrum, this back part of the pelvis, is the birth gate. And during the pushing stage of labor, it actually comes slightly up and out to provide more space for the baby to navigate through the pelvis. And so when you're lying on your back, mama is restricting that kind of movement of the birth gate, making it more challenging for baby to move through this bony structure. But so many of us enter into our birthing experience with the image in our minds of giving birth on our backs because of what we see in movies or stories we hear or the expectation of our care providers. So if giving birth on your back is not the best position, then what is? Well, the best position is the one that your body and baby are happiest being in, which you will know by how much comfort you find in those positions, how your baby tolerates those positions in terms of their heart rate, whether it stays steady and reassuring, and how it helps labor to progress. Without an epidural, mamas will usually know right away if a position is working for her based on her level of comfort. When she is very uncomfortable, she is going to instinctively change her position, usually in response to how her baby needs to move as well. With an epidural, mamas usually don't have enough sense of feeling due to the numbing medication to know what her baby and her body needs, which is why constant encouragement and assistance to move and change positions is crucial for a mama with an epidural. Another way to tell if one position isn't working for baby is that their heart rate might drop, which is an indication that mama should change positions. This is why women with epidurals will often switch from laying on one side of their body to the other side of their body if baby isn't tolerating mama's current position. During the pushing stage, however, with or without an epidural, mama should avoid laying on her back. And these are my top 3 go-to birthing positions. The first is side lying, and this position is a great option for mamas with or without an epidural. In the side lying position, mama isn't having to push uphill to give birth. She is allowing her sacrum, the birth gate, to have room to move baby to to open up space for them to move through, and she's not cutting off blood circulation or oxygen to her baby by being directly on her back. In this position, mama can pull her own leg upward as she feels the urge to bear down, or if she has an epidural, she'll have a support person like a birth partner or a nurse to help her lift up her leg and bring it closer to her chest as it's time to push. A lot of care providers like this pushing position as well because it still gives them access to baby and to support the perineum as you push. The second position is on all fours. In this position where mama is supporting herself using her hands and her knees, the pelvic outlet, the last level of the pelvis where baby has to emerge from in order to be born, opens. The sacrum is able to be more flexible, to move out of the way to allow baby's body to pass through it. And again, oxygen and blood flow is able to flow freely to baby because you're not restricting the veins in the back. And your baby is able to follow the path of least resistance to be born because you're allowing gravity to help both you and your baby. This position is very instinctual for mothers to go into when they don't have someone telling them what position they should be in to push their baby. If mama has an epidural, this position is a bit more difficult, but not impossible. I've worked with mamas who have had epidurals and with help have gotten into this position to birth their babies. However, if your epidural is very, very strong, this position may not be feasible or safe for you to get into. Then my third go-to position for pushing is upright, whether that's standing, squatting, or lunging. In many cultures around the world that are much less westernized, squatting is a very common birthing practice. With standing, squatting, or lunging, the pelvis is able to open up more. You're obviously working with gravity to bring your baby down and out, and you're providing baby with a free flow of oxygen and blood flow like with the other positions as well. These positions are pretty uncommon in a hospital setting, but not impossible. In hospitals across the US, the beds come equipped with a squat bar, which mamas can use to support themselves as they push in a squatting position. So if you're interested in using a squat bar, I would definitely recommend talking to your care provider about that. When you're using a squat bar, the bed becomes sort of like a birthing stool for mama to put the edge of her bottom on, and as she gets ready to push, she can either slightly lower herself off of the edge of one section of the bed with her legs propped up on a lower section of the bed while her arms are supported on her squat bar in this squat position. Now, with any of these positions, if you've experienced a birth in the past with a 3rd or 4th degree tear, it's better to not use these birthing positions because it can really increase the risk of another more severe tear because of how quickly baby can be born. Otherwise, these are really great options to try if mama isn't seeing progress in the current position that she's laboring in, especially if that current position has her laying on her back. So those are my top 3 go-to pushing positions, but my best advice to you when it comes to pushing your baby is to do what feels right and best to you, and when something isn't working, move your body. In my Built to Birth online course, we talk in depth about how baby is like a key unlocking the keyhole, your pelvis. Movement is such a huge aspect of birthing your baby through all stages of labor, especially pushing. So when in doubt, speak up or have someone help you speak up and let your care team know that you want to change positions if one way of pushing isn't working for you or your baby. And you'll only know that by the length of your pushing stage and how well your baby is tolerating each time you push. If you want way more information regarding positions for not just the pushing stage of labor, but for each stage of labor, plus all the ways to have a happier, healthier, and easier birth and postpartum experience, make sure you check out the Built to Birth online class. Or if you're not quite ready to commit to the full course, you can try out the free mini birth class linked in the description below. Take your birth into your own hands through equipping yourself with empowering education so that when you're in the early, active, and pushing stages of labor, you know exactly what you want and how to advocate for yourself. So thanks for being with me in this video, and I'll see you in the next one. Bye.